Welcome back. To kick off 2026, we will look forward regarding tobacco control policy, what it gets right, where it's failing, and why those failures matter for people who smoke. Public health has made real progress. Smoking rates have declined in many countries. The dangers of combustible tobacco are widely understood. Youth smoking in some places is at historic lows. That matters. But here's the problem. Most tobacco policy is still built on a false choice: quit or die. That framing ignores reality. Millions of adults will not quit nicotine, but many can switch away from smoking, the single most dangerous form of nicotine use. When policy refuses to acknowledge that difference, harm does not disappear. It continues. Across much of the world, safer alternatives are treated as if they carry the same risk as cigarettes.
This is the residue that's left from the traditional tobacco cigarette. This is the residue that's left from the e-cigarette.
They don't. Yet we see bans,
There are very serious penalties. We're going to crack down.
restrictions, criminal penalties, and messaging that deliberately blurs risk.
Exposure to nicotine from e-cigarette vapor does in fact cause lung cancer.
The government think it is harmful.
Ban e-cigarettes.
In terms of heart and lung disease, it's looking about as bad as smoking.
The result? People who smoke are left with fewer options, not safer ones. If public health is about reducing death and disease in the real world, then denying safer alternatives is not caution. It is policy failure. This is where New Zealand stands apart. New Zealand chose evidence over ideology. Instead of following the most restrictive interpretations promoted under the WHO Framework Convention on Tobacco Control, New Zealand assessed its own population needs, and it recognized a simple truth: combustion is the problem, not nicotine itself. So it regulated vaping as a lower risk alternative for adults who smoke. It drew a clear line between cigarettes and non-combustible products, and it focused on outcomes. The result? Record low smoking rates, achieved without criminalizing adults, and without denying people safer choices. That is what evidence-led sovereignty looks like. The future of tobacco harm reduction rests on three principles. First, sovereignty. Countries must retain the right to design health policy based on their own evidence and populations, without policy being dictated by WHO FCTC. Second, science. Risk is not binary. Combustion causes disease. Nicotine without smoke does not carry the same risk profile. Policy must reflect that distinction honestly. And third, the human right to health. People who smoke are entitled to accurate information and access to safer alternatives. Denying those options is not protection, it is discrimination. Tobacco harm reduction is not about promoting nicotine. It is about reducing death, disease, and inequality now, not decades from now. The evidence is clear. The only remaining question is whether policymakers are willing to put people ahead of politics.